This is the second part of the abnormal psychology lecture given on Tuesday, March 23rd. We'll start with anxiety disorders. So, anxiety is very similar to fear, except that with fear, you're afraid because you know where it's coming from and you know probably what's going to happen. With anxiety, it's a little bit different. Anxiety, you experience fear like worry and unease, but it's because that either you don't know where it's coming from or you don't know what the potential outcome is going to be. Now, we all experience normal anxiety, and normal anxiety is very, very common. And it's, we're just because sometimes we're just not sure what's going to happen, and that makes us nervous and it makes us uneasy. But with somebody who has an anxiety disorder, the anxiety persists and often will transfer from something that they're aware of to a lot of times what we call free floating anxiety, which is just general overall worry and unease. Generalized anxiety disorder is when somebody experiences worry for over 6 months straight. This is one of the most common psychological disorders out there. It can create both physical and psychological symptoms. Physical symptoms include agitation, being sleep deprived, having high blood pressure, and even autonomic systems like just uncontrollable sweating. Psychological symptoms are issues with concentration. Oftentimes, a person with GAD's worries will go from worry to worry, and it will absolutely be free floating anxiety, in which a person doesn't even know what they're nervous about. They're just constantly nervous about everything. Phobias are when someone has a extreme fear of something. And sometimes this is based on previous events, like if they were attacked by a dog, or sometimes it can be genetically influenced. Like, for example, our fear of spiders or snakes can easily be influenced to back in cave people days of when being afraid of spiders and snakes was pretty healthy because it kept you alive. But phobias are very specific. There are thousands of different types of phobias out there, some of them very, very common, and some of them very, very uncommon. There are even phobias not just about things, but also about people. Agoraphobia is when somebody experiences worry or fear about being around in large crowds, being around other people, which is similar to even social anxiety disorder, another social phobia, in which someone is afraid to do things like get up and give a speech in front of a class. Panic disorder is an extreme form of anxiety in which a person who has it will experience minutes long panic attacks. These panic attacks are incredibly intense, oftentimes causing very, very strong physical symptoms like a fast heartbeat or chest pains or choking or dizziness. Oftentimes, someone with panic disorder will have reoccurring panic attacks, which often makes them not just fearful and anxious about the things that they normally are going to be fearful and anxious about, but also then being having anxiety about anxiety and worrying that they're going to have a panic attack in a public place or around people where they can't control it. Obsessive compulsive disorder is a disorder that's very much misunderstood. A lot of times people just say those who are highly organized have OCD, but that's not the case. People with obsessive compulsive order have obsessive thoughts and obsessive worry. Uh, and this is often followed by compulsion or compulsive behavior where a person only way they're going to satisfy those obsessive thoughts is by carrying out a compulsive behavior over and over and over again. Like, for example, it's normal to be worried a little bit that somebody's going to break in your house, so you lock the door. But if you're constantly obsessing over the anxiety that someone's going to come into your house and rob you or hurt you, and then you lock the door and unlock it and lock the door and unlock it 16 times, that would be an example of OCD or obsessive and compulsive behavior. Another common characteristic or another common reason why people may have OCD is cleanliness. They might be obsessively afraid of germs, which, certainly in our current world is justifiable. But they may wash their hands, uh, you know, 20 to 30 times a day, sometimes even rubbing the skin off, versus just washing their hands once or twice. Post-traumatic stress disorder is another anxiety-based disorder in which someone has experienced extreme trauma, car accidents, witnessing somebody dying, being the victim of something like rape, can cause people to have flashbacks and nightmares where a person relives it over and over and over again. And this, of course, makes them experience the anxiety and the trauma over and over and over again. Now, those people who experience intense trauma and develop PTSD, but then recover, often are seen in having post-traumatic growth, where a person is stronger and is more confident and has more self-esteem as a result of overcoming that PTSD. What causes PTSD? Well, it could be that people who experience traumas, may have a more sensitive limbic system, and so their emotional state is a little bit more sensitive just compared to others. It also can be harmful for people with PTSD to go through a process called debriefing, in which they basically relive and re-experience the emotions as a form of therapy. But that can also cause some long-term effects to prolong their PTSD. And finally, sometimes the media doesn't help either, in which the media kind of broadcasting events that are similar to those that people from PTSD suffer from, and they have to experience it again and again as they see media reports. Somatoform disorders are disorders in which people experience physical symptoms, and yet there is not really any reason for them. Somatoform disorders come entirely from having anxiety, and the anxiety that comes from different situations. The most rare conversion disorder or somatoform disorder is a conversion disorder. And a conversion disorder is essentially when a person experiences the loss of one of something that's really important to them physically, like their ability to swallow or their ability to move arms or legs. And it's often due to some sort of anxiety that they may have. Like, for example, this girl in the picture that you see below has such extreme social anxiety that she lost her ability to walk. And this is entirely psychologically induced. Now, one of the characteristics you see in conversion disorder is something that the French who named it called la belle indifférence, which is basically the beautiful indifference, in which a person is not super concerned about their physical issues because it allows them to satisfy that anxiety that they might have. Somatic symptom disorder is when somebody experiences physical symptoms that have no real that come from psychological worry. So a person might experience some intense pain or dizziness, and yet there's no physical reason to do that, and it's more of a manifestation of their psychological issues that they might have. Finally, there's illness anxiety disorder, which used to be called hypochondriasis. People who might have it are called hypochondriacs, in which a person experiences normal physical symptoms and yet believes them to be evidence of a much larger disease. And we see this a lot now, especially with the role that the internet and like WebMD and things like that play, in which people look up symptoms like if they have a headache, which is normal, and then all of a sudden they believe they have cancer. Eating disorders are when psychological factors overwhelm our body's need or ability to be in homeostasis. Now, eating disorders can be you eat too little or eat too much, though we commonly see them a little bit more in we eat too little. Why does this happen? Well, a lot of this has to do with culture. Culture has different expectations about what body image should be, especially for women. And sometimes, we look at what culture deems to be beautiful and attractive, whether it's advertising or Instagram influencers or things like that. And it can cause people to have their self-esteem lower due to these unrealistic expectations, because most people don't look that way. Most people's bodies don't work that way. This can often lead to depression and dissatisfaction with one's own state. And certainly that may cause higher levels of stress, which will then push people to not eat as much. or sometimes the dissatisfaction and depression may cause them to not eat as much. Stress can also cause people to eat more, which can cause, sometimes the purging that you might see in bulimia, or even just overeating just in general due to psychological factors. There are three primary eating disorders. One is anorexia. Anorexia starts as usually weight loss, but then you'll see an extreme drop in below normal body weight. And this extreme drop comes from this idea that they can't put in these calories because they're seen as too fat, or they're not meeting the expectations that they might have. Binge eating or bulimia is when oftentimes people may have some of the same psychological factors of anorexia, but they may break their weight loss diet, and they may binge forbidden foods that are high in fat or high in sugar. This often will cause extreme bouts of depression, anxiety, and guilt, which can cause a person to need to vomit or fast, or take laxatives to just get it all out, or to excessively exercise as a result, as a way to purge those calories from their system. Binge eating disorder is similar to bulimia without the purging, in that a person will overeat and eat forbidden foods and experience depression and guilt, but without the purging. And this usually leads to high levels of overweightness or obesity. Finally, we have the autism spectrum. The autism spectrum is a developmental disorder, and it's a disorder that's marked by social deficiencies. Basically, children who develop it, and it is developed in childhood, have an impaired theory of mind that they take with them for the rest of their lives. And so it makes it more difficult to put themselves in other people's perspectives, to have empathy, and to even understand how other people may be feeling due to the way that they act. This is almost entirely genetic. We see some specific genes which also can cause the autism spectrum. Childhood vaccinations do not cause it. Stress hormones as well as genetics may cause the development of autism, and it's much more prominent in boys than in girls. So what are some symptoms of the autism spectrum, which is a number of different developmental disorders all kind of thrown into one primary kind of spectrum? One is extreme social impairment. That's one of the biggest things that you see with the autism spectrum, is this idea of social impairment. This social impairment, because a person doesn't know how another person is feeling or how they should expect to behave in a certain situation, will cause communication issues in which language development is delayed, and language skills and communication skills are incredibly delayed and lowered. And because of these communication issues and social impairment, this can often lead to slightly lower intellect, because there's a lot of struggling that occurs in school due to the social impairment and communication issues. And then also you see a lot of repetitive behavior, where a child may carry out the same behavior over and over and over again, as a way to basically get into this habit of things that make them comfortable, even if it may not be necessarily socially acceptable. Asperger's syndrome is a high functioning person on the autism spectrum. It is a little bit of autism. It is a little bit different from autism, though there is a lot of similarities. The biggest difference from autism is two. One is that language development is not delayed with Asperger's syndrome. And usually intellectual capability is relatively quite high compared to those who have more classic autism. However, there is sometimes the social impairment, where people just don't know exactly what is socially acceptable, and they may still struggle with overall communication despite the lack of language delay. And that is where we stop.